Hello and welcome to our broadcast. Remember, this is ICS TV in conjunction with KBJ TV and Hype Agency. Remember, being a Tuesday, we do have a health talk and health day in our college ICS and in the entire branches that we have around. So welcome to our health talk today. I am Elvis Masika.
Joshua Mila. We are privileged today to have visitors from IMPROVISED Kenya who will be discussing more and stuff about health thing.
Thank you so much, ICS, for this opportunity. Yes. Yeah, so my name is Lucy. Yeah, I work with IMPROVISED. Support the students in sciences and technology.
Thank you so much for giving me this opportunity. I'm Lucy Kabara, working with IMPROVISED under the youth program. I did mainly IMPROVISED, which means Operation 000. It's a program for people living with HIV.
My name is Nick Obama. And Nick works with IMPROVISED as well, supporting a HIV program in the county that is testing and prevention.
So our channel, feel at home, these are all good education and analytical stuff. So you can give us a general view. You can start with Nick. Can give us a general view of IMPROVISED services.
Yeah, thanks once more. IMPROVISED is a wide program. I may not preempt everything in IMPROVISED, but strictly measure on HIV and prevention. Yeah, so as we are all aware, most of the people out there have known IMPROVISED as a leading program in terms of HIV patient management. Yeah, so generally that we do in my department as prevention. That we take care of clients who are already on HIV care by supporting them get HIV treatment through medication, and we also follow them up in their homes to just ensure that they have a better livelihood as they undertake their journey through HIV treatment and management. However, away from just HIV clients, remember we are now talking of prevention, and IMPROVISED as a program has come a long way in ensuring that the levels of HIV infection reduce in the country, because when I talk of the country, it means we cover a wider region, not just Western Issues alone. So currently our main focus as IMPROVISED is ensuring that we cut the chain of transmission, and especially among the youth. And that's why we are here in the college today, because the focus is how do we reduce this transmission among the young people, especially 10 to 24 years old, because again the prevalence is on the rise among this population. Yeah, so that informs why we at IMPROVISED have decided to focus on the young people. They are university and higher learning institution students, and part of it is reaching out to the community for people who may not be in colleges, but again are available in the community, and that whatever they do impacts their livelihoods in terms of health, and specifically on HIV matters. So away from just treatment and prevention, remember also concerned on the mental health of these individuals. And you can't prevent HIV without addressing mental health. if you want to manage HIV prevention, then you also have to ensure that people are well in terms of their social being, they are well psychologically, generally, mentally, everybody is okay. That's when they're able to reason well and even take up the prevention measures on matters HIV. That comes without saying that we also focus on IPV. IPV in this case is intimate partner violence. Intimate partner violence has proven to be one of the sources of HIV transmission, since it involves violence within or amongst people who are in an intimate relationship. So remember, if there is violence amongst intimate partners, then chances are one partner will dominate over the other, and they can control their sexual life, leading to the ease of HIV transmission. So as AMPAT again, we are addressing matters related to IPV, that as a way of preventing HIV spread by giving a platform, an open platform for youth to come out and share the issues that relate to IPV and GBV in general. Yeah, so in a nutshell, that's what we are focused on.
HIV, and we wanted to know if there is any other initiative or any other project that you're focusing on besides HIV. Is there any other thing that you're focusing on?
Dealing with orphan vulnerable children, whereby they take care of children who are orphan. They have their own shelter as AMPAT, but not only for positive, also negative. They support GBV and also counseling services for all the population.
Remember, even as we came, we didn't come only for HIV services. You realize we came a full package. We have our chronic disease management team with us. Actually, that is more leaning towards hypertension and lifestyle diseases than HIV. Remember, we're also talking of enabling better livelihoods. So, but apart from just HIV, when we talk of GBV, it comes with counseling. Yeah, we also offer in general counseling and mental health counseling, just to ensure that people have proper livelihoods. And if I may add to what Whitney just said on OVC, that's orphans and vulnerable children, these are a program within AMPAT systems that is focused on uplifting children who are orphaned and those who may seem to be vulnerable in a way that they can't afford the basic needs, the basic livelihood needs. So AMPAT comes in to support their caregivers in terms of just uplifting them, maybe provision of startup businesses or boosting the already existing businesses.
I think go to Mr. Luke. Yeah. How you guys AMPAT can collaborate with other communities or organizations? Have you collaborated with them?
Yeah. So maybe just before I go to that question, also there are other diseases that we also handle. We have around TB screening at 20%. We also have STI screening at 20%. Yeah, as also Nick had mentioned, we have service around TB screening and also support also for the same purpose that maybe undergoing GBV. Yeah. And then also now back to the partnership. We realize that one, before we even go to the partnership, AMPAT is supported by USID, it's funded by USID. So the immediate partner, because we are dealing with the immediate partner from that is actually the ministry. Yeah, so the ministry is the first and major partner. Yeah. We also realize that in working with the community, there are also other NGOs in the US that AMPAT also comes to work with. We have like other organizations like NIA that support the kids also. Yeah, so AMPAT doesn't work standalone. We also have other partners that we work with. Also, we have other partners that implement the same program around which we hear the likes of VCT and the rest. So we also work with them just to ensure that we deliver the services to the citizens. Yeah, our services are free, so yeah, we are not like a company, we are running a business. Yeah.
So where do you guys get funds?
So the funds come from USA. We realize that there is a pool of, let me say that that the taxpayers in USA that every month they we need funds to come and support programs around HIV, TB, malaria. Yeah, so we get the funds from them.
That I'm HIV positive. I've been on medication for 20 years. It's not been easy to take medication for about 20 years, but I'm just trying and keep on motivating myself that everything will be okay. I was born with HIV. And I've been taking my medication well for the past 20 years. So far, I believe that I will live for long, the way God had planned for me. And the reason I wanted to work with AMPAT was to encourage other youths. If you could take your medication well, you'll be okay. Some of those youths, maybe they have been infected, maybe in teenagers or even in adolescent stage. I always encourage them to continue taking their medication because I know if you get someone who is positive, who is encouraging you to take the medication, you take the medication, you'll say, if this person made it, who am I not to make it? So that is my experience. I have experienced stigma from the community, but it was back then when people had no knowledge about HIV. That's why you have come to the media to say that I'm HIV positive, and being HIV does not mean that you don't have life. You have life and you still continue your life, you continue your career. I'm also continuing, I'm also a comrade. I'm a student in LGW College, taking social science. It does not mean if you are HIV positive you can't continue your study. You can continue your study, you can work. I work with AMPAT and I also study. I'm doing both, I'm multitasking it. So being HIV does not stop you from anything. If you are HIV, take your medication and everything will be okay.
As we were discussing, there's a lot to be discussed, like there's abbreviation like IPV, there's a JPV, there's a OVC. These are the abbreviations for the terms that our communities should understand and get educated. How do you guys approach them and teach them how does it work and how the program is being done?
Yeah, so maybe just to define the applications. Yeah, it began with IPV. I'll talk about IPV and GBV. So GBV basically stands for gender-based violence. Yeah. So this is any form of abuse or neglect that is done to an individual simply because of their gender. Yeah. So GBV can happen to anybody, whether male or female, of any age. Yeah. And then now IPV is a form of GBV. It stands for intimate partner violence. So this is a form of violence that happens between people who are in an intimate relationship. Yeah. It can be a boyfriend and a girlfriend, it can be a husband and a wife, as long as they're in an intimate relationship. Yeah. So and the GBV and the IPV takes various forms. It can be physical, where here you're talking about the physical victim. It can be emotional, stemming all the way from emotional neglect. It can be verbal, where one person is verbally abused. Yeah. So it can even be economic, whereby in an intimate relationship, because one spouse has more financial power over the other, they intentionally, denying them financial support. Remind me the other abbreviation you mentioned? OVC. Yeah, OVC stands for Orphan and Vulnerable Children. It's basically a program where we support just the way it started, orphan and vulnerable children. Yeah, the children who are orphaned. Yeah, they don't have parents. And here the baseline is that they are HIV positive. Yeah, they don't have parents, or they find those houses where they are headed by a child. It's basically the child who is there because the parents are not there. So we have support services that they are orphaned. Yeah, so those are the implications, the meaning of those implications. Yeah.
And what is the role of the health that provides the program?
So maybe you can just
or I say, what are the roles that the health provides to ensure the campaigns are successful?
Okay, the role that the health partnership provides to ensure that the campaigns are effective. Of course, there is a bit of educating. Yeah. We realize that lack of education leads to lots of these vices. Yeah. So stepping in all the way from educating the community that these services are there. Yeah. And that they are being offered at point A, B, C. Yeah. So that bit of sensitizing the community about our services and how the community can benefit from them. And then, of course, the way we mentioned some time back, partnering with other health organizations, the community offering these services, and now the bit of now actually offering the services, ensuring that we have the manpower, we have the staff that offer these services. Yeah.
So just a quick one, maybe you talked about IPV, GBV and AVC. If I can just ask, we have this family called LGBTQ because of change of generations. So I don't know if these prevention measures do work with the LGBTQ family, and if yes, how do they work? Because in some ways we cannot see the reality. So does these prevention measures and these all abbreviations work to the LGBTQ family?
Yeah. Maybe LGBTQ, just to define their acronym. I know it is common, it is also there. L standing for lesbian, G standing for gay, B standing for bisexual, T standing for transgender, and then Q standing for queer. Queer. So as we mentioned earlier, the services we offer are free. Yeah, and we don't discriminate one based on their gender or the sexual orientation. Yeah, so the preventive services all the way running from the condoms, they're actually free and available to everybody. So free, regardless of of their faith, their belief. Yeah, they are open to all, and they actually work. Yeah. Actually, if you look at the origin of event-driven PrEP, initially it began with the kiddos. Yeah, the men having sex with men. But then over time, because the research proved that it works for everybody, yeah, we now push further. So it works for people just beyond themselves. And so the training services are available and free to all. Yeah.
We have online platform where we have started to mobilize people in internet, TikTok. We have not rolled it out, but we are starting it so that we can get more youths in the community, so that they can get more information about HIV. And also we have every school holiday, we always encourage youths, and we always engage them in the community level. Like this last month on April, I visited many places like Ipkabos, the interior places, to encourage more about HIV, more about PrEP, more about use of condom. So we are trying to encourage youths. Now we have started to come in school, colleges, so that we can get more youths and get more population to understand more about HIV, so that people could understand more about PrEP and everything concerning GBV. We are at the community level and we have started it. Maybe in future I'll open up my account to talk about more about HIV on TikTok, Instagram, even WhatsApp platform, and also Facebook account.
SAMPA as a program has its own established systems that runs campaigns on the various areas that they cover. As a county, what we've done right now, remember even the last World HIV Day theme was that let communities lead. So as a county, we actually started riding on that theme. That for a long time we've been offering services in health facilities. But again, if I may just ask even for Josh and Elvis, how long does it take for you to visit a health facility, even for any other service? It takes so long. So in short, we cannot reach out to everybody if we wait for them to come to the facility. So we opted now to get out to the community. And how we've done it, we've engaged the community administrators. Those are the chiefs, and we have the community health promoters, the CHPs, in terms of just advocating the community. And through that entry process, we're able to reach out to different community groups. For example, we've done advocacy programs in the slums, in Langas, in Huruma. We are doing this in all the other areas within the county, just to ensure that we reach as many people as possible with information regarding HIV, as well as the programs within USAID and Patuzima.
Now, you have done all the program. What are the company, what measures have you put in place to ensure that this program is effective and you have put the impact on the society?
First, I'll say at this moment, I can't really say that we have achieved. We are yet to achieve.
Okay.
By the time we get to zero HIV infection, then we can say as IMPACT we have achieved. Because again, that's what we are looking at. Of course, there are very positive steps in terms of first ensuring suppression among those who are HIV positive. You know, when you suppress, when you achieve viral load suppression, then it means the transmission rates are already reduced. Getting people on prevention is another milestone that we are really covering with this campaign. Yeah. But again, looking at the whole process, where do we want to be? There's empathy we want to see a HIV-free county or nation. And of course, we work with the policy makers just to ensure that we are covering all these things. For example, as we sit here, remember we were to be here with our MOA counterpart. Apologies, actually, he had another engagement, so he couldn't make it here.
It can support them in empowering people who are living with HIV and AIDS, so they can come out and speak out, so that they can receive maybe help from the health services or the stations.
Like today, you turn up to be positive. The only encouragement that I can give is to take your medication well. If you take your medication well, you will be virally suppressed, and when you're in that stage, you cannot transmit or you can't be sick. So maybe HIV does not kill. First of all, you have to take it in your mind that HIV does not kill. If you have HIV, you can live a longer time and a longer period. The only problem is that if you don't take your medication, you'll get sick and you'll get opportunistic diseases like TB, meningitis, and all those diseases that are coming up with HIV, but HIV does not kill. So if you take your medication well, if you become suppressed, life will go on and you will live a longer period. And if you are a youth, you are HIV positive, don't worry. I know some of you youth say that, who will I marry because I'm HIV positive? But don't take that in your mind, because if you're HIV positive, you can get married to a negative person or a positive person and still have children who are negative. In IMPACT program, we have a program called Prevention Mother to Child Transmission, whereby if you are positive and you are pregnant, come to the facility, they will guide you how to take care of your kid until that kid is negative after 2 years. So if you are positive, take your medication well, everything will be okay. In terms of your career, life will go on well, and I'm the product of it. 20 years in medication, nobody can say that I'm positive. If you want people to know that you are positive, don't take your medication. You'll get sick and people will know that you are positive. But if you take your medication, nobody can tell that you are HIV positive. Sometimes I tell people that I'm HIV positive, but they don't believe, because they say that you look healthy. Nowadays, you can't check someone and say this is HIV or this is HIV negative. If you take your medication well, you will live a healthy life and life will go on well.
So looking forward, looking for the future, what are the plans, what are the hopes that people living with HIV should, or what are the plans?
Okay, as we have seen every data up to now, an individual can live with HIV for a lifetime. Yeah, based on the research that has been going on and improvements in the treatment and everything that has been going on. So we look forward to a time, yes, as my colleague Nick mentioned, we look forward to a time when we'll be having zero transmission of HIV. Yeah, and then those who are HIV positive, they will be suppressed. Yeah, and they will no longer be having the spread of the virus. And those who are positive will be different, and life will be very different. So that's what we look forward. Yeah, that a time will come whereby HIV will be a thing of the past. Yeah.
Fear ends is where success starts.
Yes.
Yeah, so the beginning of success is actually the end of fear, in short. We are here with Whitney. Whitney is a living example of someone who's lived with HIV for 20 years. Look at Whitney. Are you able to tell that she's HIV positive just from looking at her? Yeah, very beautiful, very healthy. Yeah, so if you are out there and you are afraid of coming out loud, within AMPA have systems that guarantee you confidentiality and privacy of your own information. Yeah, and then from AMPA systems, you're able to freely express, you'll be taken through mentorship until that time when you're actually ready enough to loudly speak about your HIV status if you're HIV positive. Maybe just in addition to that, we are not only talking of those who are HIV positive. We have so many HIV negative people who are afraid of knowing their own status. Why? Because of what we have done, behavioral bit of it, that people feel worried. What if I tested I'm positive? They don't want to know their HIV status. But we are saying, at the moment you eliminate that fear, get an HIV test, know your status, then that's the beginning of better things to come. So we encourage all of them to know their HIV status. Those who are positive, will mentor them through the AMPA systems just to be able to live HIV positively and healthy.
So, to Madam Wiki, maybe what is your advice to a person who wants to become a HIV AIDS activist?
I'll encourage them to come out, speak about HIV, and be proud of themselves. First of all, if you want to become a champion of HIV, you have to stop self-stigma. If you start loving yourself and say that I can make it, I'm HIV positive, I'll live longer.
Take care of ourselves, as much we can. I usually tell people that it's not theory until it happens. When you have the opportunity to prevent yourself from getting HIV, live a positive life when you have the chance, please do it. Yeah. As much as yes, we know that we can live positively with HIV, for a lifetime. But then if you can prevent it by just being careful and following, the directions given by the medical field, please do so. Yeah.
We're coming to the end of our talk today, and thank you so much, Mr. Nick. Thank you so much, Madam Lucy. Thank you so much, Mr. Luke, for taking time to be part of our panel today. We are so much grateful and hope the masses out there you've learned a lot. Maybe just to tell you that from our visitors we'll get a point that maybe the truth is like a lion. If you release it, it will defend itself. Speak out so that you can live, you can be advised, and have a good life tomorrow, regardless of your situation, whether you're positive, whether you're negative. They are here for you. Visit their facilities and know more about it. It has been me, Elvis Masika, alongside Joshua Milaho, and this is ICS TV in conjunction with KBJ TV and Hype Agency. See you later and have a good day.